President Irfaan Ali on Friday said the government will be spending $20 in each dose of the Russian-made Sputnik vaccine, which will be sold to Guyana by the United Arab Emirates. This means that a total of $4 million will be expended on this first tranche of Component 1 of the Sputnik vaccine, while plans are in train to secure another 200,000 doses of Component 2.
$20 per dose, right? So 200,000 is like $4 million US. Very expensive. It's very expensive, but it is an expense we can't spare. The health of the population is critical. This will call for some adjustment in the budget and so on. But this, as I said, we are not sparing any expense on this. We are working on making the resources available to ensure every single Guyanese vaccinated.
Guyana and the UAE are currently finalizing the logistics to have the 200,000 doses of Component 1 of the Sputnik arrive here. The president assured that local authorities have already established a supply chain and storage facilities for these vaccines. Some disappointing news, however, is that vaccine manufacturers Moderna and Pfizer have told Guyana after great discussion that it will not be able to sell any vaccines to the country until 2022. Dr. Ali said while this was not the response Guyana was expecting amid an ambitious plan to vaccinate the majority of the population before the end of the year, the government will continue to engage at the bilateral level on the issue.
We have to get the vaccines. We have explored the Pfizer vaccine. We had great discussions with the company directly, and then we were told that this can only be available 2022. Same with the Moderna. The AstraZeneca, we have contacted the company directly. We are very grateful for Indian Prime Minister Modi, who ensured that production out of India came in. But again, the production line are being stretched right now globally.
Some good news is that the World Health Organization has told Guyana that it will receive 24,000 doses of AstraZeneca on Monday from COVAX. This is promising for the country's expanded vaccination drive, although it is down from the initially promised 100,000 doses. Dr. Ali said, with registration for persons 40 years and above started already, these vaccines will see a major shift in the country's vaccination campaign. In order to store and manage the vaccines and execute the task, the Ministry of Health has engaged various private sector players with the capacity to assist in the rollout. Additionally, the Guyana Defence Force has agreed to make some 400 ranks available to help with expediting the registration of citizens, while persons from local government bodies, civil society, medical and nursing students, and the medical brigade of the GDF will be trained to assist in the process. Persons will also be recruited as volunteers and will be vaccinated as they lend their assistance to the countrywide vaccination drive. The president made another appeal to citizens on Friday to act responsibly in helping the government achieve herd immunity and curb the spread of the virus.